Welcome Internet to psychoanalytic cogitation, and today I wanted to talk about a very interesting topic, one that's not often talked about, so I really wanted to delve into it. So this topic, as you would have guessed it by the title, is the effects of mild physical illness in psychotherapy. So here I wanted to make it explicitly clear, when I mean mild, I really mean mild, meaning that I mean having a bit of a fever but not too much, coughing or being a little down. I absolutely don't mean chronic illness, cancer, chronic pain, physical pain. I really mean those illnesses that are more mild inconveniences rather than jeopardizing the health of someone. Typically, people that are going to go work even if they have a cold or influenza or certain forms of COVID that don't trigger many symptoms. Those are the types of things I'm talking about. So illnesses that don't prevent you from living your daily life, just maybe making you feel less good or not as apt to do a lot of things that you would normally do, with less energy perhaps. Well, those illnesses, and I want to make this very clear, I'm not a medical doctor, and my knowledge in medicine is very, 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 very limited. But I wanted to talk about it from the side of a psychologist and the effects it has on a session, because it has the effects both on patients, when patients are sick, but also when psychologists are sick. And it's something I wanted to delve into because I find the topic quite interesting, and I think it would make for a good and quite adapted video. So basically, when a patient comes in with a mild physical illness, one might think that that would prevent psychotherapy from being fruitful, that the patient would be too tired to concentrate, too bad to be really there, and when it becomes more intense, of course, the patient doesn't come or the session is cancelled, right? But when it's just on the line of just the person being physically more exhausted or unwell, well, the session can sometimes carry on. And of course, this is a case-by-case basis, right? But when it carries on, I have witnessed things that are very, very interesting. That the patients will often speak more about intimate thoughts without the talking or the triggering of the clinician. They will go more into detail into certain aspects that often they don't necessarily dwell on most of the time. As if, in a way, the more background information was coming through, as if, and here I'm going to get a bit technical, it's as if the conscious mind was less in control of something because of the illness. The illness takes out such a toll that other things come through. And you get often a new perspective on events, or something that's kind of the same, but different. Different in this incredibly subtle way of the events are recalled in another way, in a perhaps more nebulous, but also sometimes slightly different. Like, for example, patients might tell you about feelings they never felt the first time you talked about a certain event, or even sometimes go into those feelings and show that they were not just simple, they were very complex, very nebulous, and it's things that they did not necessarily talk about because they were not necessarily fully aware of it, as if the illness had lowered their mental defenses and barriers towards the relationship, and that since become more knowledgeable by the patient, and they can acknowledge them and share them more easily with the clinician. And when I mean that is that the patients are not withholding necessarily the information, but since that they're not fully aware and conscious of, well, become conscious through the illness. The illness gives takes a toll, meaning that the mind is not 100% and the conscious levels of control go down. And that's what I've experienced. And sometimes you get new insight into old situations, but sometimes you get the direct thought of the patient. The patient might be more direct with you, more explicit. He also might criticize the clinician. And all of that is good and it can be used in therapy. And that's what makes it so interesting, is that the physical illness is part of the session at that moment. It helps and hurts the therapy at the same time. Hurting it because the patient is not fully 100% there, but helping it in the fact that free association, as Freud called it, is much different when the body is a bit weakened. And of course here I am absolutely not advocating for anyone to get sick before their sessions, because that would be completely counterproductive, right? It's just that I've noticed that, and it's an observation I wanted to share and see if other clinicians agreed or if other people completely disagree. And what I also find very, very, very interesting is that some people who are very aggressive, very antisocial, or who have manipulative traits might become more direct with those traits and with the clinician when they have a form of physical illness. As if they were not withholding the information, it went straight to you. Instead of trying to cut corners and get you to say something, they might be completely frank with you. Or elements that they were consciously withholding from you are going to become much clearer, much more explicit, and much more transparent. Which is very important, because with these types of patients, the whole effort is to try and get them to be at a more genuine place, even if that genuineness is a place of destructivity. So it's important to get that, and it's also a good insight for the clinician to see, in a way, what is being relegated to the background of the patient, meaning what's there but not explicitly there, right? As if you, at that very moment, got a bit of a snapshot or a little je ne sais quoi of the unconscious mind, just a frame in a movie. But that frame sometimes is enough to understand certain things and to get to the core of the matter, and it's very important. And that's for the patients. But when the therapist is sick, well, I've talked a bit about this to my colleagues, and I also have my own experience of it. And it works a bit in the same way. You kind of don't necessarily withhold as much information, or sometimes you just, what is in your background, what you would hold there, saying, I'm not sure if the patient is ready to hear that, or I'm not quite sure it's going to work, or you become more spontaneous and you share it more. And sometimes it gives for very interesting sessions that are very productive, both on the clinician side and on the patient sides. So it's very interesting to see that something that should be completely counterproductive becomes so basically interesting. And for the clinician, there's so many other things, so many other aspects. Like, for example, because you're sick, all your defenses are not there. So you kind of go more with the flow of the phenomena and the flow of your own consciousness as well. And when something pops up and seems to be a good idea, in normal times you might keep it for later, saying, well, we'll see where we're at, and we'll be very careful with this. When you're sick or ill with a mild illness, you might not have that. You might just go, yes, why not? It seems the right time. Like the defenses, I think the superego is less there, because basically the mind is so focused on just maintaining a stability of functioning, that I think that things like the superego just calm down, or consciousness itself just is more fluid. And it goes to a point where basically when the fever becomes very important, some people, of course, have delusions, meaning their mind is fully just producing things, and here it becomes a distortion of reality. But that's not what I'm talking about here. I'm talking about the very mild illnesses that are so current and so uneventful, and yet in therapy they do become so very eventful. At least That's how I see things. And I am very curious to, if there's any clinicians out there listening to this video, if you've made the same observations, or if on the contrary you disagree with me. Because here I'm not talking the truth, right? I'm talking just about something that I've witnessed and something I've experienced, but in no way, shape or form am I saying that I have the right answer. So this is pretty much it for the video, and if you're interested in those hot takes, please let me know in the comments. I'll see you in the next one. Bye.